Hey, happy Tuesday, everybody. We have Tracy BQ, Development Coordinator at Advocate Aurora Health with us today. Thanks for coming.
Hi, John. Thanks for having me.
Yeah, I appreciate it. So, fortunately, I, as well as the district, have had an opportunity to work with you in the Aurora Foundation in different capacities, but I don't know if everybody else knows what the Aurora Foundation is about.
Yeah, well, I'm happy to share. My role with Aurora Healthcare is primarily to work with individual donors in the community, business owners, organizations that want to give back to us and help us with our patients, our programs, equipment, volunteering. There's a lot of different ways that people can get involved with us. And I will tell you, it has been a very busy year. 2025 has been good.
How many years have you been with the foundation now?
I will be celebrating 4 years in January.
Wow.
Yeah.
It seems like you just started.
I know. It's been very fun. I've learned a lot. It's been a good ride so far.
Well, let's talk about some of the fun things and the beneficial things that the Aurora Foundation does to support the hospital, right?
The hospital.
Essentially.
It's in my role is mostly for Lakeland Hospital in Elkhorn, and then also Burlington Hospital as well. This is my area, and then the surrounding clinics is my focus for the foundation. As a whole, though, our enterprise is the Midwest. It's Wisconsin, Illinois, and then we also have a southern area too that encompasses parts of Georgia and South Carolina and North Carolina. So yes, we are a very large organization, but my focus is hyper local to serve my community where I live.
How nice is that? Well, let's get on to some of the things that the Aurora Foundation does. What do you want to talk about first?
Yeah, with the holiday season about ready to kick off, I have a couple of updates. We are one of the 6 featured charities at the Christmas Festival, formerly known as the Santa Cause, which is at Pier 290.
I think we have a picture of that here, don't we?
Yes, our booth is beautiful this year. So visitors can start this. Let's see, it would be Friday. The day after Thanksgiving, you can take a cruise around Geneva Lake and look at the beautifully decorated shores. And before you board the boat, you can look at the charity's displays. And this is our display here. You can buy raffle tickets to enter to win some of these great prizes. We have a getaway to Sedona, Arizona.
Whoa.
We have some Brewers tickets and an autographed baseball, although don't ask me who it is, because I totally forgot.
So all these things here, are these things?
Those are our prizes.
Those are your prizes
that
for
you
the
can
raffle.
win. All of that collectively is close to $7,000 in value.
That's some good stuff.
Yeah, it is. So stop down.
Wow.
It goes through.
When is that?
Black Friday through New Year's Eve or New Year's Day.
Okay. And people can stop at Pier 290.
Purchase the tickets for the Santa Cruise and purchase tickets to win some of these great prizes.
Awesome.
Just to give you an idea, we received almost $13,000 last year for our EMS program, which we use to train first responders in the area. So we're hoping to get that equal amount, or if not more, this year.
That's the exciting thing about what you do and being local, is that the Aurora Foundation, although may be a big organization, what you're doing with it and these fundraisers affects our emergency services and our hospital services right in our community.
Exactly. Just the local communities.
Yeah, it's always nice to know when you go to fundraisers and things like this that the money you're supporting that organization with is staying at home.
Yep, right
nice. Here. All right. Pier 290, don't forget.
We're also going to be in the Elkhorn Christmas Parade too on December 6th. And
okay.
I don't know if we've done that before, so we're excited. We're having a Grinch themed float.
So you're building a big float, big trailer, the whole thing?
Yes, we're doing it. It'll be fun. So stop out for the parade as well on the 6th.
Do you have fun things you're throwing off the float?
I worked with our friends over at Andy's Candies, and they gave us some nice treats to hand out to everyone in attendance.
Great.
Yeah.
Great. We hope that's a nice day too. All right. So what do you want to jump to next?
We had a successful fundraiser. It's our big one of the year on October 25th at the Lake Geneva Country Club. We raised over $140,000.
Is this the right picture?
No,
that's not.
I don't have a picture of this one.
You don't have a picture of that one. All right.
I'll quickly share though that it's for we're launching a cardiometabolic clinic at the Lakeland Hospital. This is new to our area, and basically patients that are at high risk for a cardiovascular event have a combination of different risk factors. That could be high blood pressure, high cholesterol, diabetes, being overweight, someone that has, and I'm not an expert in this area, but
you're doing pretty good though. You're doing good.
Is you have all of those things going on together, puts you at a higher risk for something to happen. So what we're proactively working with patients at these new clinics is to get those levels down so that they don't have something happen to them. It's more of a proactive approach. So we raised $140,000 at this event in October. We're having a clinic launched at both Lakeland and Burlington hospitals come the beginning of next year.
Wow. How great is that?
So we're really excited about that.
Yeah, you know what I think I'm going to do? I'm going to look up here. No, maybe that's not going to work. I was going to try and find that. I think we forgot to add the picture of the new emergency room entrance that you brought.
We did.
We did.
We had that, but we forgot.
We did.
The emergency department is open at Lakeland. That was a 2-year, $14 million project. It's an expansion and a renovation, and hopefully you don't have to go there to see it, but if you do have to go, it is absolutely beautiful and very nicely high technology area.
It's amazing. It's amazing. Really nice. The space that was added and the technology, and yeah, you wouldn't even recognize it from the old emergency room.
The old emergency room was small and getting a little dated. It definitely served its purpose, and the team that worked within that small space did a fabulous job, but they are loving this new expanded area.
Yeah, even the lobby area, how nice it is compared to what it was. And that whole addition, kind of somewhere in there, it swallowed up the old emergency room, but
you can't even tell.
I know. Right? It looks like a brand new building.
When you're in that space, it's almost like you don't even feel like you're at Lakeland.
You don't.
That's over 100 years old, but this space is new and beautiful. So.
Yeah. We hope we don't have to check it out, but
in case you do.
If the people it needs to serve, it'll serve them well.
Yes.
Okay.
Agreed.
All right. So what else have we got? You had a list here.
I do have a little list here. Now that other picture that you popped up with the check from the Geneva Lake Women's Association.
Okay.
That one there. So that's exciting. We launched Reach Out and Read at the Elkhorn Rural Residency Program at Lakeland, which means every child visiting for a well child visit from birth to 5 leaves with a complimentary book to promote early childhood literacy. And this is all completely funded through philanthropy.
Wow, that's amazing. So every child, how many
that visits the
do
clinic.
You anticipate you could give out in a year?
I think there was like 500 kids at that clinic location that we would serve in a year.
Oh wow!
I think I'm hoping that was a correct
that's
number.
Amazing. That's our approximately.
But yeah, so they visit more frequently the younger they are, and then it turns into more of an annual visit as they approach 5. But to just get them familiar with the books, holding them, having the parents interact with them, and just reading an actual book is so important for these younger patients. A lot of times our doctors will say that they put the device and the screen in front of a kid, but there's just research is saying there's just so much more benefit for a book and the interaction with the parent reading together.
Right, doing something together.
Exactly.
Yeah, that's amazing. That's a great idea, and that's a lot of books. So I hope you give out. Yeah, I hope you give them all out.
Thanks, John.
All right, so moving on. Where do you want to move to next?
Well, the other thing I was going to talk about is we've partnered so much with the high school on a variety of different things, which has been so great. We received a very large gift in kind donation from Jackie, which their facility is out in Kenosha, and they provide clothing for patients in need. Maybe they have clothing that was destroyed in an accident and they are being discharged and need something new to wear. Maybe they had to submit their clothing for evidence and they need something to leave the hospital with. For a variety of reasons, we have compassion closets set up at both Burlington and Lakeland Hospital for patients that need clothing items. No questions asked. We supply them with whatever they need and when they're released.
That's so amazing. And I think helping the foundation and bringing the kids out there and being fortunate enough to be out there with the kids, it's one thing them pitching in and doing the work. It's another when you tell them the story of these clothes are taken off the truck. Here's who they go to. Here's what they do.
Mm-hmm.
And to watch them and their eyes get big and go, whoa, this is important.
Yeah.
Like what we're doing is important.
They're
it's not
making a
just a
difference.
box.
Correct. Yeah, we should clarify. We had 175 boxes donated, and the students from National Honor Society and maybe some of the sports teams
Mm-hmm.
came and helped unload this truck. I think we actually had 2 truckloads this last time.
We did.
And put them in our storage room, and then I'm actually looking to have maybe them come back and help with sorting. So we sort them out and then we help distribute them to all the sites across Wisconsin and Illinois.
We would love to do that.
Yeah.
I know it doesn't hurt either. I know you weren't there the last time you weren't able to be there. I think some people you work with were, but it never hurts for them to give the kids lunch after they're done unloading the truck.
Yes, food is always good with teenagers.
That's become a big draw, and they pass that around school. So when I go back to say, hey, here's what I'm looking for, they're like, hey, they give you lunch.
We can provide a sub, and then they provide the muscles.
Right.
That's great.
That works out pretty good. All right, thank you.
Yeah.
And I think there was one last big topic you wanted to talk about, right?
This one was so great for the month of October. A few years ago, we started a partnership with the worldwide organization called Hope Scarves. Essentially, they get headscarves for female patients that have a new diagnosis of cancer. And with this headscarf in a very nice package comes directions on how to put the scarf on and wear it different ways. So it looks super cute. But also, most importantly, is a personalized note from a survivor. And they read that as they begin their journey on fighting cancer. And it just means so much to our patients. So we started this 2 years ago, all through philanthropy and funded through donations. We took it to the next level, though, this year in October. At 15 different locations, we did a scarf drive. So we collected scarves from the community where they will then get sent to the Hope Scarves headquarters where they're dry cleaned, packaged up, put the little notes with them. And how many do you think we got?
It's a one-day drive, huh?
No, it was the whole month of October.
Okay, the whole month of October. I'm going to say you got 100.
We actually got 415.
Holy.
Which was one of the largest drives that the Hope Scarves organization has ever had with one of their partners. So
That's amazing.
And this was the first time we've ever done that.
First try.
And one of the locations was the Elkhorn Area High School. So there's a new club called the Cancer Awareness Club, and they alone collected 50.
That's unbelievable. That's amazing.
Yeah.
Way beyond what I thought we would have collected.
We love that. We typically hand out about 100 throughout the year. So those would be new diagnoses just here in this area. So sadly, I wish that number was lower, but that's about how many patients get a new diagnosis at our Southern Lakes Cancer Center.
Yeah. Well, I suppose, getting that amount is wonderful, and you probably hope you still have that amount a year from now, right?
Right. That
Ideally,
want to increase.
But we know that's not practical.
Yeah.
and it's gonna brighten people's day.
Yeah, they do. The patients really
give
love
them hope.
receiving these scarves. So yeah, that's a picture of us,
Yeah.
myself and our hospital president, Anya Horner. And then in the center there, we have one of our donors, Heidi Lloyd. She's a great local community member involved in so many things like Rotary and
She's a professional volunteer.
She's amazing. She gave us a ton of scarves, so we're so happy to have her bring those to us.
Heidi is so wonderful, and she does so much for our community in so many different ways.
She
It's
does.
incredible. And yeah, she never pats herself on the back. She just keeps on going.
I know.
Yeah. All right.
Yeah.
Well, so how does someone donate? If I want to donate, what are some ways that I can donate?
Well, what do you want to donate? Do you want to donate
Let's
your
start with, I
time?
want to donate money.
You want to donate money, then you can call me and then we can have a conversation about what exactly you want that donation to go towards. That's the nice thing about our foundation is that 100% of the gift goes to the program that you choose. So you could say, Tracy, I want to support Reach Out and Read. Great.
Oh.
So we would take your gift and 100% of that would go towards purchasing books. Or you
Okay.
could say, I would like to support Hope Scarves. So all of that money could go towards the Hope Scarves program. Or you could say, you know, that cardiometabolic clinic really sounded interesting. And I know some people that have those risk factors, and I'd really like to support that program. So those are some of the things that I could talk to donors, or I do talk to
Sure.
donors about.
What about a legacy gift where I say, you know, upon my passing, can I set up something to go to you at that time?
Yep, we have
Okay.
that available as well.
Okay. I want to volunteer my time now.
Yes, I'm going to put you in contact with our director of volunteers at the hospital. I don't oversee that, but Janine Cowan's
Okay.
great, and we have wonderful dedicated volunteers at all of our hospitals in the area and our Southern Lakes Clinic that would welcome you to stop by and help volunteer your time.
Perfect. Are there any other ways I haven't mentioned that people can get involved?
We're always looking for stories too. Like if you have a story of a loved one or yourself, and you want to share how maybe a physician made a difference and helped impact your life, or you can always share your story with us too.
Okay. Perfect.
Yeah.
Well, thank you so much.
Thank you. I really appreciate this, John.
We appreciate all you do for the foundation. We appreciate the foundation, your partnership with the school district and the community. And you're always out there and you're always doing your thing. So thank you for all you do. And with that, we are going to wrap it up here. So thank you, everybody. Take care, and we will see you next time.